Zoya Lampay, Executive Director of Asia Society Philippines. Welcome to another Asia Society Conversations. Tonight, we take time to discuss our health and economy in the time of COVID. More specifically, we are nearing the end of a 2-week timeout that our medical frontliners have requested, and that had delayed plans to reopen the economy. Will we, or should another Asia Society conversation, re-emerge from MECQ? Tonight, we take time to discuss our health and economy as sharp as ever. More specifically, we are nearing the end of a 2-week. The number of COVID cases continue to rise in the Philippines. Meanwhile, while our doctors and nurses battle the virus on the front lines, the government is struggling to save and revive our economy. Our people are desperate for work and for money. Our consumer-driven nation urgently needs to get moving. But the latest economic figures has been more bleak than even the most pessimistic projections. So, with public health resources stretched, our medical frontliners had sounded the alarm. We need to regroup. We need a better plan. So, can we win both the public health and socio-economic sides of this war against COVID? Tonight, the discussions will be very, shall we say, animated and very diverse. And we are honored to have Dr. Albert Domingo, a health systems and public policy consultant, to help us. Albert obtained his BS Molecular Biology and Biotechnology and his MD from the University of the Philippines. He was awarded a Chevening Scholarship by the United Kingdom, where he obtained his Master of Science in Health Systems and Public Policy from the University of Edinburgh in Scotland. He's also familiar with the general principles of health law, and he has years and years of experience in global public health at the country and international levels. He has worked with the USAID, the WHO, and health offices at all levels. So before the lockdown, you would have found Dr. Albert teaching indoor cycling classes at a local fitness gym. So maraming salamat, Albert, for joining us. He will be moderating our discussions and will be doing the honor of more properly introducing our panel. Thank you to everyone. We look forward to hearing your expert thoughts. And on behalf of Asia Society Philippines, thank you for listening in. I'll now let Dr. Albert lead us in this conversation.
Maraming salamat, Joy. Thank you so much to the Asia Society Philippines for having me as your moderator in tonight's discussion, the quintessential battle, or is it really a battle between health and the economy? It is our privilege actually tonight to have, shall I say, advocates from both sides. So I'd like to introduce the three speakers whom we will be kind of dissecting as far as their positions and their brains are concerned. And I would invite everyone to use the chat, the commenting function of Facebook, so that you can always post your comments. I'll try my best if this is like an improv, asking any questions, doing the thing from economy, from health, and so on and so forth. But I need your help. So having said that, let me introduce the speakers in no particular order, except that they appear on the poster in this sequence. So I'd like to introduce first Dr. Maria Naval Rivas. Dr. Rivas is a pediatrician and a professor from the Ateneo School of Medicine and Public Health. Hi, Dr. Rivas. Good evening.
Hi, good evening, Dr. Albert.
Nice to meet you here. All right, our second resource speaker is, here we go, Mr. JC Punong Bayan from the other side, or is it really an other side? Let's see. Mr. JC Punong Bayan is an economist and co-founder of usapangecon.com. Hello, JC. Good evening.
Hi, Albert. Good evening.
Hello. And finally, another ally from the medical profession and also an advocate of mental health, a nurse and doctor, Dr. RJ Nagit founder of the Youth for Mental Health Coalition Incorporated and National Chair of Akbayan Youth. Hello, Dr. RJ.
Hello, Doc Albert, and good evening po sa lahat ng nanonood ngayon.
Hi, good evening. Let me ask everyone first. So picking off from RJ's advocacy, how are you doing, Dr. Rivas? Dr. Nabs, how are you doing?
Okay, I'm kind of busy, surprisingly. We're not busy because we're just staying home, at home, but it feels very busy. We have
Can you
meetings
give
before.
us, yeah, ma'am, can you give us a feel of how it is in the hospital? Could be your experience or what you are gathering from those who are on the front lines, our colleagues who are seeing patients. How is it?
Well, towards the end of July, the emergency rooms became very busy again. Patients started waiting for long hours in the emergency room tents. And so there were a lot of discussions in the doctor's Viber thread, whether we are ready to
So Dr. Rivas is saying
take
that
in
since,
patients. And
yeah,
that's quite a difficult situation for, let's say, the leader or maybe the medical director
yeah.
to call because hospitals are really open.
Doc RJ, from your side, this is not to illustrate the contrast of age between Dr. Rivas and Dr. RJ, but in the medical profession, I think it's a given that there's an optimal age around Dr. RJ's age, which is roughly the age of an entry level resident who is probably spending the most hours seeing patients right now. How are your colleagues at that level? How are they? Are they still fighting strong? Are they tired? How is it?
Well, I can actually base it from the posts that I see on social media. Most of them are very tired. And I think a lot of them are suffering from some form of moral injury already because they've been encountering a lot of indigent patients in the hospitals. And of course, we all know that not all hospitals are capable of handling COVID cases. So right now, they're actually very tired also. That's why, of course, it's part of our advocacy actually to provide support to them. So, of course, it's somehow frustrating also on their end, especially they're the ones that are in the front lines also.
Right. But you mentioned indigent patients, and the term indigent kind of reminds me of an economist, which is my transition to JC, to Mr. Punong Bayan. So JC, we always talk about on the medical side the number of patients in the hospital, the lines at the emergency room. But Dr. RJ mentioned the indigent patient. So how is it from the side of economic indicators? First of all, can you give us a contrast before COVID, BC, and after COVID or during COVID? How has the economy been from that time until now?
Thanks, Albert. So we're actually living through historic times when it comes to the economy because just last week, the Philippine Statistics Authority reported that the economy actually contracted by 16.5%. And that's the biggest single quarter contraction of the economy, even beating previous crises. For example, if you think of the worst crisis before, we had the martial law, and from 1983 to 1985, we had 9 consecutive quarters of negative growth. Natalo natin yun kasi hindi umabot ng 16.5%. But besides that, unemployment is also at a record high of 17.7%. That's the highest since the earliest records. And then some groups are estimating that as many as 5.5 million Filipinos might become poor because of this pandemic and the economic crisis that it has wrought. Hunger is also at its highest since 2014. And yung SWS, Social Weather Stations, they estimate yung number of people who are pessimistic in the economy. For example, how yung percent of adults who say that their lives worsened in the past 12 months, that's also at a historic high. So however you look at the economic indicators, Albert, it's pretty grim right now.
Pero JC, parang medyo, kasi ako, hindi ako, well, kaming tatlo actually, hindi kami economist. Parang pag sinabi mo kasi kay Dr. Nabs, tsaka kay Dr. RJ, tsaka kay Dr. Albert na nag-contract, parang iniisip namin yung muscle na lumiit or parang in medical terms, atrophy, parang lumiit. Sa karaniwang tao, kung tatagalogin natin, ano yung senyales? What are the signs? O, di ba, Doktor? What are the signs and symptoms out there so that we can actually, para bang makonect natin na pag sinabi ng ekonomista na yung GDP ay, ano ba yun, nasa recession na ba yun? Tapos nagko-contract ng ekonomiya, ano yung itsura sa labas? Anong itsura?
Mm-mm. Well, Albert, actually, hindi siya mahirap i-imagine. Kasi, for example, if you just look at the jeepney drivers, for example, na dati namamasada, ngayon namamalimos na. Yung mga favorite restaurant natin na nagsasara na lang bigla, nakikita natin sa social media na sarado na bigla dahil hindi sila nakatanggap ng ayuda. Tapos, yung mga locally stranded individuals na gustong umuwi ng kanilang probinsya pero siksikan sa mga, for example, yung sa nakita natin sa Rizal Sports Complex. There's so many ways to see the manifestations of this recession. Pero kinakabahan nga ako kasi baka hindi natin nakikita masyado sa media. Kasi marami nga sa atin ay nakakulong essentially sa ating mga bahay. So there's an element of hidden economic misery that we're not witnessing. Pero besides that, and there's so many ways. Hindi siya mahirap i-imagine, Albert.
All right. So there is an element of hidden economic misery. So parang medyo may mystery ng konti. But all right. So maganda yung point ni JC, no, yung ating mga kapatid na nagmamaneho ng jeepney. Alam mo RJ, eto medyo sabihin nating sensitive ng konti pero kailangan pag-usapan natin eh. Pag ikaw ay kasama sa medyo middle to upper class or sabi nga ng mga ekonomista, tama ba RJ, na parang quintile 4 or quintile 5, medyo mas mga mayayaman, parang hindi naman nararamdaman eh, parang mas maganda nga yung traffic ngayon kasi walang mga jeep. Is that a fair statement to make or are we missing on this hidden economic misery that we should actually be tuned into?
Well, sa tingin ko naman, lahat naman tayo are affected. But of course, we are not affected equally, kumbaga. So meron mga sectors talaga that are greater risk in terms of falling below the poverty line as compared to others. But of course, I think it's a fair statement naman na sabihin na parang lahat tayo naapektuhan ng pandemyang ito. Kasi either way, kahit na mayaman ka, hindi ka naman immune to being infected with COVID. So wala namang ganung pag-decrease ng risk factor. And sa tingin ko rin, aside from talking about the economy, I think it's also important to talk about ano yung mga social implications ng pandemic na to na hindi naka-capture ng mga numbers that we already have. So, especially malapit sa akin yung usapin ng mental health. Kaya, of course, nandiyan yung effect ng isolation, yung mga lockdowns naman natin, it's actually separating people from each other. So, yung mga psychosocial supports na yan ay nawawala na compared to before. Dati yung mga schools natin are safe spaces, pero ngayon yung mga tao nasa bahay na lang nila. So merong mga impact yan sa mga kabataan, sa mga LGBT, sa mga kababaihan, no, that are actually experiencing some form of violence na I think hindi rin naka-quantify ng pandemic na to. So I think we also should talk about that, especially if we're going to talk about the economy.
Doc RJ, you mentioned about schools and we do have a pediatrician with us, di ba? Mga bata. Dr. Nabs, among your patients or even your own kids, your mga nieces, nephews, but as a pediatrician, can you give us a feel of how it is? Kasi I think just today, one of the parang biggest news items today was there was an executive order or a memorandum from the executive secretary that came out that said that school opening by order of the president has been moved to October as far as DepEd is concerned. Dr. Nabs, in the practice of pediatrics, kasi parang minove yung school eh, bakit ba, can you help us understand from a health perspective, ano ba yung silbi ng mga school? Eh di ba parang sinasabi ng karaniwan ng karamihan ng tao ngayon is, ay nako, isara na lang natin yung mga schools kasi baka magkahawaan lang tayo ng COVID sa schools. But is there like a hidden economic misery factor na nakikita natin, or hindi natin nakikita, hidden nga eh, na pag sinira natin yung school, may kapalit yun, may katumbas. Dr. Nabs, what can you say about that? Dr. Nabs? Ay, nakamute po yata si Dr. Nabs. Dr. Nabs? Doc Nabs, can you unmute? There. Okay.
Okay,
Doc Nabs, go ahead.
All right. So now, okay. So I was saying, developmentally, may effect talaga sa bata yun, no? Yung hindi sila nakaka-physical schooling during the school age period. Kasi, it's natural, the development of a child during a certain age, up to let's say toddler years, parang ano yun, parang sa bahay talaga yung mga skills and social relationships na develop niya. Supposedly, pagkatas nun, nagpupunta sila sa ibang setting para makakilala na sila ng ibang tao, they will socialize with other people. As RJ mentioned, it becomes a safe place for them somehow, especially for children who have some, parang may traumatic issues or dynamics sa loob ng bahay nila, pwedeng maging gano'n. So, talagang malaki yung magiging effect that the kids are not physically going to school, both developmentally, because they're now ready to open themselves up to other people in terms of natural development. So, ngayon, wala silang opportunities na gano'n.
Okay. So, eto ngayon yung twist na gagawin natin. Actually, if you've noticed, dear friends and those who are tuning and watching, think of your questions now. Medyo biniliktad ko ng konti. Napansin nyo yung nag-defend dun sa economic side yung dalawang doktor. So medyo tinitimbrihan ko na si Sir JC. Kasi tatanungin ko ngayon, Sir JC, is there an economic value to locking down? Is there something useful out of locking this up? I mean, we just heard from RJ, meron tayong mga mental health issues na nangyayari. Maganda yung point ni Dr. Rivas, si Dr. Nabs, na developmentally kailangan yung mga schools eh. And yet the doctors, the medical groups are saying, we need to go to a lockdown because the virus is going around and ravaging the population. JC, is there an acceptable economic benefit from a lockdown?
Yes, Albert. So actually, kanina narinig kita na you alluded to a battle between health and the economy. But you will be surprised to hear from me na actually walang trade-off between health and the economy. And I agree completely with the point na kailangan tratuhin ito first and foremost as a health crisis rather than an economic crisis. Kasi yung ekonomiya natin, magre-recover at magre-recover yan. Pero hanggang hindi naaampat ang pagkalat ng virus ay hindi mo pwedeng buksan yung ekonomiya agad-agad. And that is a point that we've seen illustrated by the recent imposition of the Modified Enhanced Community Quarantine, kung saan binuksan yung Metro Manila to general community quarantine back in June, if you will remember, invoking economy. Pero that strategy backfired sa economic managers dahil nga hindi nandiyan pa yung virus essentially. At kahit nabuksan mo, luwagan mo ang mga restriction, ay hindi pupunta ang mga tao sa mga malls, hindi sila kakain sa restaurant, hindi sila mag-commute, etc. So, nakita natin na hindi talaga gumagana yung strategy na ganun. And I think this boils down to the fact, Albert, na naging late yung gobyerno sa pag-respond sa pandemic. Kasi if you will look at the experience of Vietnam, late January, early February ay umaksyon na sila agad against the virus. They imposed localized lockdowns. Effective ang kanilang yung kanilang testing ay naging laganap. Tapos yung kanilang contact tracing ay naging effective. And they also actually imposed a national lockdown noong April po, but that lasted for only 3 weeks. And after 3 weeks, they were able to safely reopen the economy kasi maraming araw na wala silang bagong cases. So that perfectly illustrates yung point na health first and foremost before the economy. Pero unfortunately, Albert, that's a point na until now, it's lost sa economic managers. So sana, ang gusto ko lang iparating din ay marami ekonomista ang nagsasabi na health muna bago ekonomiya, pero hindi ganun yung pag-iisip ng economic managers natin, and sana magbago na yun as soon as possible.
May nabanggit ka, JC, no, na medyo babalik ako sa Econ 11. O wala akong formally Econ 11, pero kunyari nag-Econ 11 ako. Yung sinabi mo, yung mga manggagawa na pumupunta sa pabrika, parang ang dating sa akin nun, parang production. Tapos yung sinabi mo na yung mga kumakain sa restaurant, bumibili ng damit, parang consumption. ano ba yung pinaka-dominant sa Pilipinas? Kasi parang siguro para maintindihan ng ating mga viewers, kung yung isa gumagawa ng mga produkto, tas tayo namang mga consumer ay yun nga parang dati kumakain tayo sa mga eat all you can, kumakain tayo sa fast food, biglang ngayon stay at home, 'di ba? Ah, can you give para bang a concrete example na kung sila ba may Vietnam, kung kaya natin sanang ayusin yung para bang health aspect, ay baka umandar uli yung production at baka umandar uli yung consumption. JC.
Thanks, Albert. So actually, maraming paraan para, actually magandang tignan yung GDP report ng Philippine Statistics Authority last week kasi pwede kang drill down dun sa statistics. Two-thirds kasi, Albert, ng ating ekonomiya ay pinapatakbo ng consumption spending. Ito yung spending ng mga pribadong households, ng mga individuals. So for example, yung mga malls, yung pag mag-shopping ka, kumain ka, that makes more than two-thirds of our economy. Pero nakita natin sa second quarter from April to June ay lumagapak yung consumption spending. In fact, it contracted so much. And that's unfortunate kasi nga hanggang hindi confident ang mga tao na lumabas ng kanilang mga bahay at gumastos tulad ng dati, hindi mo mababalik yung ating ekonomiya doon sa pre-COVID levels. But aside from that, Albert, ay yung investment spending din ay nag-contract ng napakalaki. So ito yung paggastos, for example, sa mga bagong bahay, sa mga bagong building, sa yung mga construction projects in general. So yun din yung nag-contract. Another way to look at this, Albert, is ano yung mga sektor sa ating ekonomiya na nag-decline. So nakita natin, for example, na yung agriculture, meron siyang surprise growth. Meron siyang surprise growth actually nung second quarter, pero yung services, tsaka yung industry, so manufacturing, construction, nag-contract talaga sila. Kasi yung mga factories nagsara, yung mga construction projects ay hindi na ituloy. So, ayun. So, talagang i-pull down growth. Pero more than that ay yung services din. Kasi yung services, ito yung may mga face-to-face interactions. For example, sa restaurants, sa mga bars, etc. So, yung mga transactions, yung mga sektor na maraming face-to-face interactions, sila talaga yung nag-contract. Pero lastly, I have to note na meron din namang mga sektor sa ating ekonomiya na nagtathrive. For example, yung mga pwedeng online transactions, etc., e-commerce, online games, and then meron din mga peculiar na nauuso. For example, yung mga plantita na gumagastos sa mga halaman ay biglang yun for some reason. So ganun. Pero for the most part, Albert, ay nag-contract marami, a huge swath of our economy was really devastated, especially, for example, tourism and transportation. So, kailangan pumasok yung ayuda ng gobyerno, and so far, we haven't seen enough economic aid being spent.
I wanted to touch a bit on that concept of para bang yung consumption na two-thirds. Actually, interesting, hindi ko napansin niyo po mga kaibigan, medyo nawala ako for a while kasi yung wifi ko nag-contract rin. So, lumipat ako sa online at nabanggit ni Doc, nabanggit ni Sir JC yung online, no? Parang online selling, no? Parang on hand, di ba? The private message, HM, how much? Ganyan, yan. Sis, wala akong ganyan. Yan, sabi nga nila sa online. Pero may isang bagay na kahit subukang i-online, medyo nahihirapan. And I'm pertaining to telemedicine and the practice of medicine, which is non-COVID. So actually, Dr. Nabs, I wanted to shift to you. As a practicing physician, did you notice any trends in the volume of patients that you have been seeing? Kasi parang I would understand before COVID, most doctors ang common complaint ka dati, naku, late na naman dumating si Doc, ang tagal ng pila sa clinic, ang daming pasyente. Kamusta na yung pila sa clinic yun? May pila pa ba? Or are you doing telemedicine? How is practice, Dr. Nabs?
Well, half of the time I'm doing telemedicine. Half of the time I go to the clinic. But the clinic is, a lot less. You see the hallway of the hospital empty siya because the triaging is very strict. Bawal yung may fever, bawal yung may cough cold, gano'n. Dapat yun, reserved for teleconsult. Bawal silang physically, there with you. So half of the practice goes to teleconsult. Now, the problem with teleconsult is it's not easy. There's a lot of challenge in terms of, checking the patient, whether, let's say that's a cough. I mean, there's no way you can listen to the lungs over internet. So parang, alam mo na, parang we depend on epidemiologic data in terms of, let's say, the most common thing that can be happening to this person at this time of complaint. So, ganun muna nag-work. But really, I also feel that primary care should be strengthened because, these people, pag may konting lagnat, ubo, at walang gustong tumingin sa kanila, then they end up going to the emergency room after a while, no, because they really want to be seen. That's also something that that remains unanswered in terms of strategy. Like who looks at these patients? I've heard of people telling me in my community clinic na, Doktora, walang gustong tumingin sa akin kasi may lagnat ubo ako. Titignan niyo po ba ako? So parang ganun yung tanong.
Ang hirap, no, Doc? Kasi parang, konting sore throat nga, parang nakakapraning eh. Even I'm sure among us physicians, magkaroon lang tayo ng konting kati sa lalamunan or parang ubo na may halak ng konti. Parang eto na ba si COVID? So we are actually seeing, it's already 30 minutes into the discussion. And for those of you who are watching us, tulungan nyo naman kami. Bigyan nyo naman kami ng questions. I'm sure there are a lot of questions on your mind. You can, if I'm not mistaken, si Direk ay nakikinig. Tama ba na magko-comment lang sila at makikita naman dun sa Facebook. And our backstage staff will be, Nax may backstage. Pati sa online may backstage, sa StreamYard. So the backstage staff will be typing into the chat box and we will be able to read your questions. And in some cases, baka i-flash pa. So I'll just quickly summarize what we've been discussing. If you've noticed, dear friends, as JC mentioned, there really is no battle. I was just like exaggerating and being hyperbolic about it, the battle between economy and health. Because to begin with, you need to be healthy if you are to produce something or to consume something, right? And habang nag-aantay tayong tanong, babalik uli ako kung yari magpretendo ko ng economist. Can you tell us more about this concept, Sir JC, yung human capital? Parang sa mapakinggan, no? Parang actually capital sa ekonomiya, yung tao. Okay, one thing we noticed in public health practice is that yung mga LSIs, locally stranded individuals, and ROFs, returning overseas Filipinos, for the longest time, for how many years, decades, di ba ang sinasabi sa Pilipinas, the exporter of very high quality human labor. Okay, friends, it sounds cold and kind of insensitive, pero I'm sure the economists will understand. We do not mean to disrespect our Filipino workers. We're just talking this on a clinical para bang perspective from the economic point of view. Sir JC, how has the effect been? Kasi parang, paano na yan? Actually, kinakabahan ako ngayon eh. Malapit nang kumanta si Sir Jose Marichan. Hindi, malapit nang kumanta si Jose Marichan ng Christmas carols. And yet we still have COVID. And I mentioned si Christmas carols kasi traditionally, ang mga remittances, tama ba? Ang mga remittances ng mga OFW, pumapasok towards Christmas time. Paano na yan? Ang pumasok is yung mga OFW kasi nawalan sila ng trabaho, nagbalikan sila, andito sila lahat ngayon sa Pilipinas. What's going to happen, Sir JC?
Isa nga yun, Albert, sa nakakabahala. Kasi if you look at the statistics, yung inflow ng OFW remittances ay paliit ng paliit. In fact, back in May, nag-contract ito ng double digits, 19.2%. Samantalang back as recently as January, lumalago pa yung OFW remittances by mga 6.6%. Tapos March, April, and May, nag-contract na siya. And this has lots of implications kasi babalik tayo doon sa punto nung consumption-driven economy. Kasi yung paggastos ng mga private individuals and households nakasalalay for the most part, hindi naman for the most part, pero for a large chunk of it, is because of OFW remittances. So, bumalik na yung OFWs, wala silang trabaho at pagbalik nila dito, wala rin silang kinikita. So, as I mentioned, merong economic misery. Tumaas talagang economic misery at unfortunately ay magre-reflect ito dun sa consumption data natin. So, I think that's one of the drawbacks of having for the longest time, tulad ng nabanggit mo, parang labor export policy, which actually started dun sa previous worst recession natin back during martial law, kung saan ang daming, yun ang ugat actually ng OFW phenomenon, dahil back in the 1980s, we had a severe economic crisis. Lumiit yung ating ekonomiya for two consecutive years. That's the worst post-war recession that we've had before the COVID. And that prompted so many people to go out of the country and look for jobs. Actually, medyo nabawasan na yung outflow na yun over the past decades kasi gumanda na rin naman yung economic situation here in the Philippines. Pero ayun nga, so we're seeing na as much as a tenth of our population kasi OFWs. Tapos nakakatakot dito na ano kahanda yung gobyerno to absorb and support all those OFWs who will be returning. Babalik tayo doon sa punto na mukhang hindi sapat yung ayuda na ibibigay ng gobyerno based doon sa mga nakikita nating draft doon sa economic stimulus packages that actually today they will be finalizing in Congress. So kailangan bantayan yung ayuda, kailangan sapat iyon, especially yung mga OFWs who are returning.
So thank you for that, JC. Actually, si JC medyo advanced mag-isip. Kasi si Miss Judy Grace asked via Facebook, sabi ni Miss Judy, there are sentiments that we are back to being the sick man of Asia, literally and figuratively. How can we possibly recover? So we heard from JC na yung parang ito ba yung bayanihan 2, yung parang yung linuluto sa Kongreso at sa Senado. So parang meron yung stimulus package. Hold that thought, Sir JC, babalikan natin yon. Nabanggit kasi ni Miss Judy yung sick man of Asia. So parang mukhang malinaw na from a macro, from a large perspective, yun yung pinag-uusapan ng mga ekonomista. Pag nag-dive naman tayo dun sa mga individual patients namin nila Doc RJ at ni Doc Nabs, parang what do you think, maybe I'll start with Doc Nabs, what do you think, ma'am, is the para bang, wag man natin sabihin magic cure kasi wala pa talagang cure, pero ano ba yung sa ngayon, pwede natin, nagigigil ako parang ano ba yung pwede nating gawin para medyo kahit papano umayos ng konti yung ating health response. From your perspective, Dr. Rivas, kung meron kang pagkakataon na makausap ang IATF at baka may nakikinig sa kanila ngayon, ano po ang isasuggest ninyo na dapat gawin natin sa health response? Dr. Nabs?
I think ang kulang pa rin is education campaign. Ang dami pa din hindi nakakaintindi na kung meron silang, let's say, close contact na nga sa bahay na nagkasakit, nagpipilit pa talaga silang lumabas kasi wala silang simptomas. So, ibig sabihin, kung hindi nakakarating yun dun sa mga tao, kulang tayo dun sa campaign na yun. Maybe, in the mga journals, ang sinasabi nilang dapat i-focus is yung aspect ng virus in terms of it spread in terms of venue, it spread niya in terms of ventilation, and in terms of vocalization. So parang yung tatlong aspect na yun, so di ba parang una nag-mask tayo, so that's the vocalization, matatanggal yung spread, no? Pero hindi natin binigyan pansin yung ventilation. So pinabalik natin sila lahat sa opisina without making sure that employers know what the adequate ventilation for an office should be in terms of lessening spread of COVID, diba? So yung mga ganon, so may mga bumalik sa opisina. So pag wala silang kaharap, magtatanggal sila ng mask, hindi nila alam some of the, there is sustained air presence of the virus, especially if the circulation is poor. Yes, droplet siya, madaming mamagsak. Pero may mga natitira sa air, especially if circulation is poor. So bumalik yung tao sa ganun, Kaya kumalat sa opisina.
Yes, that's a very good point, Dr. Nabs, kasi naaalala ko yung mga kaibigan ko, pasintabi po sa mga personal friends ko na baka nanonood na nung nag-GCQ, biglang nagpuntahan sa mga restaurant at nagsipag-postan sa Facebook na So it's so good to see you again, A, B, and C, eating together. Tapos in fairness sa kanila, meron naman silang physical distancing. Pero yun nga, Doc Nats, I agree with you as a doctor kasi parang napakamot ako ng ulo na parang, teka, nasa loob kayo ng air-conditioned na lugar. Tapos parang kahit magkakalayo kayo, pagbukas ng aircon at kumikot na yung hangin, hello, COVID na ang mangyayari sa atin. Okay, so having said that, and again to my dear friends, it's my way of saying, please, kahit mag-relax bigla, eto na, pumapasok na yung balance between health and economy. Kasi from what I understand, Sir JC, to be fair to our economic managers, is it correct to para bang interpret na the reason why they started allowing restaurants to open up, it's because of the consumption-driven economy, and there are a lot of employees who are dependent on working in restaurants? Is that a good, fair para bang inference, JC?
So for the longest time, yun nga yung sinasabi ng economic managers, kailangan nang bumalik ng mga tao sa kanilang mga trabaho kasi otherwise magugutom. In fact, marami nagsasabi na kung hindi mamamatay daw sa COVID ay mamamatay sa gutom dahil hindi sila makapagtrabaho. Although I will pose a counter-argument to that, Albert, kasi actually in other countries, ang ginagawa nila ay kung hindi talaga maiwasan yung lockdown kasi nga health muna bago economy, binibigyan nila ng ayuda to replace the lost incomes of people. And this could come in many forms. For example, merong wage subsidies, merong zero interest loans for workers and businesses. So maraming paraan para ayudahan mo yung mga tao para hindi na nila kailangan na lumabas para magtrabaho at kumita. In other words, you are paying people to stay at home. So that's the way to incentivize them para hindi sila magpalat ng virus. Pero ang nakikita natin dito, Albert, sa Pilipinas ay takot na pumasok yung ating economic managers dahil daw baka masaktan yung credit ratings natin, baka lumobo ang utang sa Pilipinas. Pero I think, Albert, dapat sa panahon ngayon hindi mangibi yung ating economic managers na gumastos. Kasi especially dahil nandito tayo sa situation kung saan mukhang kailangan natin yung lockdowns, parang hindi siya maiwasan as has been requested by the medical frontliners tulad ninyo. Kaya kailangan, kung ganun, kailangan open all the floodgates for more spending on aid. For example, yung Bayanihan 2 na nabanggit mo kanina, 162 billion lang at most yung gusto nilang gastusin. Pero in fact, ang losses sa ating ekonomiya sa second quarter ay 700 billion pesos. So kulang na kulang yung ayuda na gusto nilang gastusin. So that's very unfortunate.
All right, that's a very good point, JC. No, parang muntik na katang tawagin Doc JC. I know you're a PhD candidate, pero I was thinking you're a medical doctor kasi parang nako-confuse na ako kasi parang kinakampihan mo kami, which is gusto namin. Pero actually, actually mga friends, so parang scripted to eh. Sasabihin talaga namin it's all about health. But I hope we're all getting from the discussion that there really is an interconnection. There is no split. There is no economy first, health first, because you need one for the other, and vice versa. You need health for people to be able to work, and you need work for them to be able to be healthy. So it's really a balance. That's a very good discussion. And I'd like to emphasize or echo yung sinabi ni Jason na you pay people to stay at home. Okay. Pupunta tayo doon. There is a question. To direct, keep the question on screen. I will go to it after this. Pero bago yun, I will now somehow capitalize on another hidden talent of Doc RJ. Kasi si Doc RJ, aktivista rin yan. Alam ko na head yan ng isang para bang youth organization of activists. At binanggit kasi ni JC yung pay people to stay at home, no? So medyo papasadahan ko lang ng konti. As a doctor, paying people to stay at home or directing the money directly through ayuda instead of the normal para bang economic activities, it sounds to me like a bypass para mga doktor eh. Parang kung hindi siya makakain kasi may problema, may bara yung kanyang wag na bakaokrayin ako ng mga gastroenterologist. Kasi may bara yung kanyang GI tract. Pasukan muna natin ng butas sa tiyan or something like that. Pero ito ang problema. Babalik ko sa economics. Yung tinatawag na leakages. Yan. Alam ni Sir JC ito. Pag sinabing leakage, it's a very parang polite way of saying corruption. Ayan. So, Doc RJ, as a doctor, kasi di ba, nalilito na ako sa inyo kung sino yung economist at saka yung doctor eh. Doc RJ, as a doctor and an activist, yun bang pay to stay at home is it feasible or may problema tayo sa corruption kaya siguro natatakot rin yung national government na magbayad sa ating mga ano. Yung bang mga grassroots na nararamdaman nyo, nakakarating ba sa kanila yung ayuda? Doc RJ?
Yeah. Actually, yung basic principle naman talaga that I personally follow and my organization follows is that kung sino yung mas pinaka may pangangailangan, doon tayo nagbibigay ng suporta. And by principle, yung ayuda is also a very efficient way, no, of redistributing yung resources na meron tayo na very limited rin naman. Pero of course, the responsibility of making sure na efficient yung pag-distribute ng ayuda at na-account lahat ng mga pinamimigay ay falls on the government, hindi dun sa tao. Pero at the same time, I would also argue na dapat yung mga tao are also informed. Kasi I think that's also one of the challenges na hinaharap natin ngayon. Especially pag sinabi mo lang na, okay, stay at home ka. Mga people in the community, stay at home kayo. So that's a very top-down approach. So it doesn't really empower people. And I think that's also one of the reasons kung bakit I think hindi rin ganun ka-effective yung mga yung mga instructions ng government, no, na magstay lang kayo sa bahay, magmask lang kayo kasi hindi natin na-address yung mga corollary issues. Like for example, sasabihin nila magmamask tayo, pero wala namang binibigay na mask. Well, I know nagsimula, no, yung government na mag-distribute ng mask ngayon after let's say 5 months of being in lockdown. So that's very late, no? So yung mga ganun, it actually stems from I think the lack of empathy ng government in terms of addressing these kinds of issues. Kasi kung laging battle framework yung titignan natin, laging war yung titignan natin, parang maging all-out approach tayo dyan. Pero I'd like to frame it as a concept ng pagkalinga. Kasi kung kunwari, parent ka, no, responsible parent ka, you would know na ano yung mga pangangailangan ng mga tao, no? Siyempre, yung 2 months na ayuda, hindi yan enough for the 5 months na naka-lockdown tayo. Yung mga benefits na dapat binibigay sa mga frontliners ay dapat na ibibigay. So, maraming mga gaps, no, in terms of that. And of course, ayoko nang i-hammer on yung sa pagkukulang ng government. But at the same time, I'd also like to highlight the participation of the people in terms of crafting the government response.
Nabanggit na ni Doc RJ yung isang word na i-connect ko na uli. Parang flight of ideas, connection. Hammer. Yan. Kailangan daw i-hammer. Sa lingwahe ni JC at tayo rin mga doktor sa epidemiology, may pinag-uusapan na strategy na hammer and dance, di ba? Na parang hammer muna para isara natin yung lockdown kasi nga kumakalat yung virus. Tapos pag medyo bumaba yung incidence, yung number of new cases. By the way, dear viewers, I'll give you a tip. Pag lumabas yung case count ng DOH, huwag mo kayong ma-alarm dun sa absolute number na parang, today 2,000, tomorrow 3,000. Ang binabantayan po talaga dyan is yung trend. Okay? Yung makikita, ito yung curve, ito na, hammer and dance, yung curve. Doc RJ, dahil naka-flash na yung question at ako'y nahihirapan ngayon na i-connect yung question sa pag-duty sa hammer and dance. Pero sabihin na lang natin na kayong mga frontliner, tayong mga frontliner, pero kasi yung question, for Dr. RJ, months into the lockdown, for the younger frontliners, what are the most pressing challenges you face? Naka-hammer ba kayo? O yun, na-connect. Because you are juniors, mas naka-duty ba kayo is more of your time being asked for, Doc RJ?
I've had a lot of conversations with frontliners, hindi lang yung mga kabatch ko ng mga doktor, but also yung mga nurses natin na I think mas matagal yung nakasama yung mga pasyente. So I think and very true yung mga gantong sinasabi nila na longer hours raw, tapos parang usually sila yung mga na-assign sa mga COVID wards. Pero of course, parang kailangan rin natin siyang i-balance in terms of equity, no? For example, syempre yung mga older doctors are also at higher risk, no, in terms of contracting COVID and developing severe forms of disease. But at the same time, another interpretation na pwede kong ilagay dyan is that it's also reflective of the very hierarchical structure na meron tayo sa medical community. So this is not just doctor to doctor, but also doctor to other health professionals. So isa rin yan sa mga kailangan nating pag-usapan. Kasi for example, I've been hearing a lot of stories na pag kunwari, doktor ka, residente ka, okay lang sa'yo kumuha ng N95. Pero pag nurse ka, yung yung medical grade na surgical mask lang. So yung mga ganun ba na kailangan natin i-correct, especially if we're in a state na parang lahat ng health human resource natin are tired and posibleng ma-deplete na rin sila.
Right. So magandang input yung sinabi ni Doc RJ, no. Actually, I can relate dyan because I'm also a physician. Medyo hierarchical talaga. Although there are some counter arguments na especially in an emergency, you will need militaristic. Ayan, nakikita ko parang baka gumagano na si Doc RJ. A militaristic approach in terms of efficiency. All right, in terms of efficiency. Before I go to another topic, I understand Dr. Nabs, you have a question. Interestingly, cross-speaker question. Si Dr. Nabs ay may tanong para kay JC. Doc Nabs, so what's your question for JC?
Yeah, I'm wondering, JC, if the economist heard of that, the Israeli strategy na parang for predictability, parang nag-4-day lockdown sila, and 4-day work, 10-day lockdown, and then they presented this equation that maintains or not to, the usual 1 to 2. So yung 4 na yun, tsaka yung 10, pa-plus nila, pareho. Tapos parang they're saying, then we be flexible. Kunwari, when the numbers increase, then we lessen the number of days of work, increase the number of days of lockdown. Have you encountered that? And are we considering that?
JC?
So, babalik ito dun sa punto ni Albert kanina na hammer and dance, na parang moving forward, how do we actually cope with this? Kasi noting na matagal pa yung vaccine ay hindi pwedeng nakasara parating ating ekonomiya. So aside from this po, Doc Nabs, ay may marami ding ibang proposals. For example, sa mga offices ay hindi sabay-sabay napapasok. For example, may batch A napapasok muna, yung batch B work from home, tapos mag-switch sila after some period of time. Pero ang risk kasi dito po ay exponential kasi yung paglago kasi yung paglaganap ng virus eh. So kapag konting kaso lang, for example, you've seen sa New Zealand, for example, after 102 days, wala silang kaso, ay biglang ang dami na nagulat sila, because of the sudden rise in cases. So, this puts into question yung mga strategies na kahit gaano tayo kaingat, parang COVID is always lurking around the corner eh. Pero I do appreciate na kailangan nating buksan yung ating ekonomiya, pero sana ay i-complement ito ng mga polisiya ng gobyerno to address the health aspect. Kasi for example, we're seeing na kulang-kulang pa rin ng mga facilities, yung maraming frontliners ay kulang yung mga PPEs, for example, overwhelmed na sila. So, nakita natin, for example, yung ECQ back in March, April, ay parang nasayang. Kasi despite that extreme lockdown, ay lalo pang dumaming kaso. So, parang hindi, effectively, parang wala siyang value added, supposedly. Although nakita natin na yung reproductive number, for example, ay medyo it's close to 1 around that time. Pero nung binuksan na, nung GCQ na, nung June, ay biglang lumaganap ulit yung mga kaso. So, ayun. So ay sana po, at least, ang isa pang frustration ko dito, Doc Nabs, ay sana din ay tinitingnan ng mga policymakers yung datos. Sana malinis din yung datos kasi evidence-based policy making tayo dapat parati. Pero from what we're seeing ay parang yung maraming instances na hindi parang may disconnect between what the data is saying tsaka ano yung mga polisiya na ginagawa ng gobyerno. So kailangan mas may harmonization between the two.
Right. So nabanggit ni JC na parang yun nga parang medyo nasayang yata. Tapos for those who are listening in, yung reproductive number na sinasabi, ibig sabihin sa bawat isang pasyenteng may COVID, on average, ilang tao ang pwede niyang mahawaan. So pag sinabing reproductive number 1, ibig sabihin, yung taong may COVID, isa lang yung nahahawa. Ang goal yata, kung naaalala ko ang epidemiology ko, is pababain yon as close as possible to 0. 1 is not winning, di ba? Parang, kasi magkakaroon pa rin tapos tumataas nga exponential. Now, this brings me to another question, and I think Doc Nabs will be qualified to answer this, Dr. Nabs. Bakuna, ayan na. Kasi ang dami nagtatanong, ayan na, may bakuna from Russia with love. Meron tayong bakuna na parating. Or kung hindi man Russia, UK, US, China, officially, the data tells us, the information tells us rather, that there are already, I think, 4 or 5 phase 3. Siguro Doc Nabs, I will parang turn over to you. Can you please explain to us in brief how are vaccines studied? Ano ba yung mga phase 1, phase 2, phase 3? bakit ba sabi nila yung Russian vaccine nasa phase 1 pa lang, tapos phase 2, tapos mag-phase 3 daw sa Pilipinas? Ano ba yung, can you give us an update, Dr. Nabs? For those of us watching, ano ba yung kwento sa bakuna?
Kasi yung parang yung bakuna, meron silang in vitro development to, yung sa laboratory, gano'n, di ba? Then after that period, maging human trial yun. So yun yung sinasabi mo, phase 1, phase 2, phase 3. Yung phase 1 niya will check its safety. Okay? Yung phase 2 niya will check its efficacy and dosing. Ganun. Yung phase 3 niya, i-apply mo na siya sa bigger population, mga 10,000 people. Doon tayo yata nag-volunteer. Diba? Yung Pilipinas, nag-volunteer tayo dun sa phase 3. Kasi, yung, let's say, the Russian vaccine na pinapasok, parang hanggang phase 2 pa lang siya.
So hanggang phase 2 pa lang?
Yeah.
Okay. And I wanted to ask, sorry to put you on the spot, Doc RJ, pero sabi kasi nila yung mga frontliners daw, baka unahin sa eligibility na mag-volunteer. Mag-volunteer ka ba sumali sa phase 3 for the Russian vaccine?
Well, of course, kailangan natin, hindi ko pa kasi nakita yung specific na na study na ginawa ng phase 2. So I need to review that muna. And of course, kung kaya naman, why not, di ba? Kung proven naman na safe siya. So, pero of course, I wouldn't risk yung general population for this. Kasi nga, kakagaling lang naman natin sa dengue controversy, if I may be very blunt about it, na meron talagang, kumbaga, mistrust, no, sa vaccine. Or, hindi lang mistrust, agam-agam regarding the use of vaccines. And that we're trying to actually counter right now. So, sa tingin ko talaga, important din yung the way it's communicated to the public. Pero at the same time, we have to establish first na okay yung vaccine itself.
Siguro, okay, nabanggit ni Doc RJ yung D word, the denvax. Okay, I think we have to kind of refresh. Ano ba yung, of course, ang dami na napag-usapan sa denvax. Maybe let's just be, kumbaga, scientific about it. The problem, I think, that those who were against the introduction of the vaccine in denvax, they were saying that the phase 3B, tama ba Doc Nabs, na parang supposedly na-cut short yung total period ng phase 3 nung Dengvaxia. And I'm saying that because I'm relating it to the question now on this so-called coronavirus vaccine coming in, na itong papasok na virus, kung yung Dengvaxia, meron ng napaunang konting phase 3, ito palang galing Russia, wala pa talagang phase 3. Tapos parang totally magsa-start yung phase 3 sa Pilipinas. But to be fair, and I'm picking up also from Doc RJ's, that's a very good objective answer. We are not new to doing phase 3 trials. Hindi ko ba, Doc Nabs? Meron din naman mga bakuna na nag-phase 3 sa Pilipinas. Can you tell us more from your practice? Parang meron ba mga ibang bakuna na hindi COVID na kahit paano na phase 3 sa Pilipinas, kung may mga ano po kayo na nare-recall immediately?
Hindi ko alam. Well, I don't have anything in mind, but the thing that even that issue in itself is, there are a lot. There are in the discussions with the physicians, there were a lot of, let's say, why we said yes to that at stage 3B, and that's because we presume that that then we are endemic to dengue, so 90% of us is presumed to have had some clinical form of dengue. So parang kumbaga, essentially second dose na yun. I mean, second, diba parang ang premise is dapat nagkaroon na bago bigyan. So parang, kaya pumayag is because na endemic tayo. And when you say endemic, 9 out of 10 Filipinos must have had some clinical dengue. So, may ganung angle yun eh. So parang, meron i-discuss yung dengue siya in relation to this new COVID vaccine. So, but, I also have personal, I know of people personally, let's say in Oxford, who actually, went through that, allowed themselves to be experimental in terms of the vaccine because of the advocacy. So, I guess what we really just need is proper consent, informed consent. If we're going through if we're going through that phase with them. And RJ is right na dapat meron tayong literature ng safety naman niya. Para naman bago pumayag yung, yung bansa o yung tao, alam natin yung pinapasukan natin.
Right. So parang yung informed consent, Doc, no, na parang alam natin kung ano yung papasukin natin, ano yung pagbo-volunteeran natin, hindi yung sasabihin lang na kasi okay yan. So parang I think that's where we need to be medical, scientific about it, and kumbaga let's appreciate it as it comes along. So it's not na no, it's not a yes. It's like let's see what it is, right? Okay, there was a question that was on screen a while ago, but I remember it. Dr. Ayan, so kanina, Doc Nabs, nabanggit niyo na yung prevention aspect na parang parang kulang yung information. Just to refresh po kasi, yeah. Go ahead.
I'm reminded early, I think I was talking to Joy early, maybe April or May, and I was parang venting out to her how come our quarantine centers are so huge and then wala siyang laman. If you remember, in May, walang laman ng quarantine natin. Bakit? The red tape to be able to enter the quarantine center at that time was so strict. Dapat non-complicated ka. Dapat wala kang high blood, wala kang asthma, wala kang ganun. So kahit mild yung symptoms mo, hindi ka nila tatanggapin. They expect you to see a health official in the PR. So parang feeling ko, how did that decongest our hospital despite the huge quarantine center? And then, so I was scrambling for answers. Bakit ganon yun, no? We cannot quarantine at home because majority of the homes in urban Manila is crowded. You know, there might be about 8 people inside a very, very small house. How do you protect the other members? So, but I think noong June, around June, nag-iba ng standard ng quarantine areas di ba? Para hindi na sa bahay nagka-quarantine. Sa doon na sa malalaking quarantine areas. But that was in June. That started in June. It could have maybe started that the moment those quarantine centers were open. And I knew of one that was already open by end of March. Meron na. So wala siyang laman. Yun siguro dapat
Right. That's a very good point, Doc Nabs. Actually, I'm happy you brought it out kasi in one of my other engagements, nabanggit naman yung introduction ko, one thing that we're looking at right now is yun nga, parang bakit hindi nagagamit yung mga quarantine center or formally, technically, ang tawag sa kanila ng DOH, TTMF, Temporary Treatment and Monitoring Facilities. One of the, mga kaibigan, i-simplify ko yung sinasabi ni Doc Nabs, no? Yun po kasing para bang requirement para ikaw ay matanggap sa isang TTMF. Kailangan, una, ang sintomas mo, mababang lagnat, konting ubo lang, konting sipon, di ka nahihirapan huminga. Ang problema, kapag ikaw ay tinawag na high-risk individual, ibig sabihin, meron kang high blood, meron kang diabetes, meron kang ibang sakit, o kaya ikaw ay 60 years old pataas, yun yung mga criteria, marami pang iba. Automatic, kahit mukhang hindi ka naman delikado, hindi ka tatanggapin ng TTMF. Kasi ganun yung criteria. May mga dahilan naman yan. I'm not saying na mali yung criteria. It's just that maganda yung nasabi ni Doc Nabs na baka it's something at siguro may nakikinig na DOH dito or baka bulungan natin sila later on na baka kailangan timplahin na siguro yung quarantine center bigyan ng parang kakayahan na mag-manage ng mga ina-anticipate na pwede maging complications. Hindi naman natin ina-anticipate na kailangan mag-tubo, mag-intubate sa quarantine center. Pero anyway, mahabang usapan yan. And siguro, ganito na lang, the time is now 7:36 at napakaganda ng ating usapan. Ito na yung parang pinaka Miss Universe question para sa tatlong candidates natin, di ba? Candidate number 1, the economist, si Sir JC. Candidate number 2, si Doc RJ, health. Candidate number 3, Dr. Rivas. Ayan. At ang ating question ay galing kay Dr. Gia Season. Ito na yung Miss Universe. Kaya rin nakaganon kayo. With the rise in cases daily, would you recommend another MECQ at the rate we're going? And why? Yan. Candidate number 1, the economist, Sir JC. With the rise in cases daily, would you recommend another MECQ at the rate we're going? And why?
Ayan. Una-una ay thanks Ma'am Gia for the question. so 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 ayan, I think mula sa economic perspective ay mukhang doon na tayo papunta sa conclusion na yun. Kasi ang ultimate problema nga nito ay tulad ng nabanggit ko, this is first and foremost a health crisis before it is an economic crisis. Kasi yun nga, kahit nabuksan mo, ipaluwagan mo ang mga quarantine restrictions, ay hindi gaganda yung ating ekonomiya, hanggang takot ang mga tao kasi meron din itong psychological, may behavioral aspect din ito sa mga tao. So, unfortunately, ang gusto kong sabihin dito ay parang we've been put in a situation kung saan necessary yung lockdown when in fact it should not be the case. Kasi nakikita natin sa maraming bansa, they are actually in fact able to open their economies. Like for example, other ASEAN countries like Vietnam and Thailand, New Zealand before yung rise of cases. So posible sanang nabuksan ang ekonomiya agad kung umaksyon agad yung ating gobyerno very early on. But if you will remember, yun nga, even back in February, President Duterte was inviting people to actually travel with him across the Philippines to boost the embattled tourism sector. Tapos naging mabagal, despite pleas for mass testing or more widespread testing, ay naging mabagal iyon. So, yun lang, nakakalungkot lang na umabot tayo sa ganitong punto. Pero yun, kailangan, unfortunately, kailangan po natin ng additional lockdowns, pero dapat ay sabayan iyon ng ayuda. So, nandito tayo sa sitwasyon na ito, pero kailangan government must also step up when it comes to giving enough aid. And I can't emphasize this enough. Kailangan nating bantayan po ito kasi sa mga nakikita nating plano ng gobyerno sa Bayanihan to Recover as One Act, parang hindi siya tugma dun sa konsepto ng bayanihan kasi ang laki ng economic losses tapos 162 billion lang ang gusto mong gastusin. May pera ang gobyerno, hindi totoo na walang pera ang gobyerno at kailangan hindi mangimi ang gobyerno na gumastos kasi buhay at saka kabuhayan ng mga Pilipino ang nakasalalay.
Thank you very much, candidate number 1. And for candidate number 2 and 3, we will have a different set of questions because we are now entering the semi-finals from Maribel Yang. Teka, nasa na ang ating prompter? Ayan, from Cel Lejano Go. Ay, napunta kay candidate number 3. Dr. Rivas, can you recommend ways to nurture the mental health of our children during this lockdown? Doc.
Well, depende sa age. The younger kids, no problem. They love being at home as long as parents, mom and dad are there. Okay, so yung mga older children, I think parents have to play friends with them. Kasi that's what they're losing now. Wala pang kaibigan. So, and be as tolerant with them as much as possible in terms of this crisis because I'm sure may mga na yan talaga, parang cabin fever, yung sinang lumabas with friends. So we just have to fill in those roles. Huwag silang awayin, really, because parents are also affected naman by work at home, right? So, yung mental state din ng parents will affect children. And since we're the adults, then we should be able to manage our behavior better in terms of relating to our children and creating a better dynamic at home. It's on us.
Yes. Thank you so much, candidate number 3. And the next question for candidate number 2 will be flashed on screen in a bit. Although nakita ko na siya at malamang nakita na ni candidate number 2, Dr. RJ. Direct, lalabas po ba sa screen para makita ng ating mga viewers? Baka sabihin, iniimbento ko lang ang question. Pero I think yung question for Doc RJ is something about, kung si Dr. Rivas touched on the mental health of the, a bit more on the younger, siguro touching now, ito na. Kasi si Doc RJ medyo nasa bagets age range pa rin. So what about the health of mental health of younger generations like yan, Doc RJ na Doc RJ to. Young professionals and teens. Doc RJ.
Okay, well, for me, laging napaka-importante naman yung pagkakaroon ng acknowledgement dun sa feelings ng person. Kasi at this point in time, it's actually normal that people experience a form of sadness, frustration, anger. Lahat yan ay normal. At parte yan ng pagiging tao na pwede kang magkaroon ng negative emotions in very abnormal situations that we're in. And of course, kailangan natin kilalanin yung positive as well as negative emotions. And continue na continue yung psychosocial support kahit na online means lang tayo ngayon. Pero at the same time, gusto ko rin nuance na konti dito kasi syempre yung pagkunwari ginamit natin yung Zoom for example, minsan nakakapagod rin talaga yung mga online platforms. And for some people, nagiging trigger rin nila yung social media. So I think the better way to go about it is to really make sure na meron tayong short but regular conversations. Kasi yun yung nawawala sa atin ngayon eh. Parang, okay, nandito tayo, meeting tayo sa Zoom, tapos diretso tayo sa agenda. So nawawala yung mga short talks, kumbaga, na I think very essential rin in terms of pacing. At siguro, kailangan maging conscious rin tayo for the people who are working from home, no? Na maging conscious rin tayo doon sa pag-blur ng lines between work and rest. Kasi very potent foundation for burnout, lalo na. I've been hearing a lot of young people, sinasabi nila, mas matagal na raw yung yung working hours nila ngayon. Tapos hindi na nag-weekend, hindi na nag-break. So I think we have to be mindful of those. And once we're conscious about our practices and integrate sila dun sa routine natin, I think mas magandang way of ensuring na okay pa rin tayo. We might not be 100% okay, pero we're not okay, pero magkakasama tayo na hindi okay. So I think that's some of the tips na pwede natin ibigay sa mga viewers.
Thank you so much, candidate number 2. Balikan pa rin eh. So actually, having answered all those questions, siguro meron pa rin akong isang question na mabilis na lang natatanungin. The time is now 7:44 and thank you so much for everyone for staying with us. Kahit nag-overtime tayo ng konti. Ito parang yes or no question. Yan. Simulan natin in the same sequence, si JC muna, and then si Doc Nabs, and then si Doc RJ. So the question is, do you think the President will extend NECQ beyond August 18? Yes or no? No explanation. Yes or no? JC?
Mukhang no.
RJ?
No.
Doc Rivas?
No.
Mukhang okay. Mukhang unanimous. Mahirap mag-judge kapag lahat ng contestants unanimous ang answer. But it's actually to be objective about it, we had a very fruitful discussion. We are definitely at a consensus. There is no battle between health and the economy. Health and the economy are actually one and together when it comes to this problem called COVID-19. The enemy is not health. The enemy is not economy. It is really COVID-19. At may humabol na question kasi maganda siya. Tatanungin ko na rin siya. Siguro ito yung tiebreaker ulit. If we continue with the current government response right now, controversial question to din. If we continue with the current government response right now, when do you think will we be able to see a COVID-free PH? Ayan, wala to kay Liza Baisa. If we continue with the current government response right now, when will we be able to see a COVID-free Philippines? Dr. Rivas, yes.
Volunteering. Actually, we talk about epidemiology, diba? Yung divinity ng virus. It will really need an overvirus. Really need to affect about 75% of the population before we actually gain herd immunity. Unless a vaccine comes. Kaya, when I say, mag-lockdown ka ba? Baka hindi. Kasi ganun, parang the natural occurrence of event. Like, lockdown, we lower so that our health system can accommodate the sick people. And then we open up so that the economy space to breathe. And then it rises, and then we lock up. We lock up again. Then it starts lower, you send them out again, it's going to rise again unless a vaccine comes. So, experts are saying without the vaccine, this is about 2 to 3 weeks.
Right. Doc RJ, your response to that question?
Hindi na mag-predict kasi looking at the situation now and how the government is responding, parang wala rin namang political commitment to have a COVID-free Philippines. Of course, recognize ko lahat ng initiatives ng mga different departments that are really working hard to make this work, as well as the different bureaucrats. Pero I think the top level leadership is not doesn't present a coherent plan. Then mahirap i-respond na to. That's why I always would like to highlight doon sa mga things na gusto ko sanang makita from the government. So number one, sana magkaroon tayo ng clear targets as well as baseline. Sana meron tayong clear criteria na nandoon yung health, nandoon yung economic factors as well as social factors na nakalagay yung privacy doon sa health factors. Pangatlo ay yung support, no? Yung ayuda na sinasabi ni JC kanina. So support for the workers at saka yung mga small businesses, as well as having participatory mechanisms with social movements. Kasi ang daming sinasabi ng mga ng mga aktivista at saka ng mga iba't ibang mga grupo. We just need to be heard, and actually pati yung mga experts natin, kailangan pakinggan yung mga experts natin, especially in public health. Kasi hindi naman pwedeng very militarized yung response natin all the way. And of course, yung pagkakaroon ng multidisciplinary na tugon dito. Kasi I think most of the factors na nakaka-affect rin dito ay outside of the health sector. For example, how we communicate, leadership, yung mga considering yung mga cultural and behavioral factors. So, lahat yan kailangan consider to have a comprehensive response. Pero, yeah, to answer the question, hindi ko po sure kung kailan magkakaroon ng COVID.
At dahil nabanggit ni Doc RJ na karamihan ng mga factors na kailangan ay outside the health sector, ang pinaka-final word for tonight ay manggagaling sa ating kasama sa speakers dito na outside the health sector. Sir JC, ano ba? So, ano bang mangyayari? In your perspective as an economist, if we continue with the current government response right now, when will we be able to see a COVID-free Philippines?
Thank you, Albert. So, at the end of the day, I think medyo nakatali ito dun sa pag-discover ng vaccine, at sinasabi ng ilan na baka next year pa, middle of next year, early next year. It's hard to say. Pero I think yung medyo nawawala pa dito sa discussions ay paano babakunahan ang mga Pilipino? Say na na-invento na yan. Kaya ba nating mag-mass produce niyan? O bibili ba tayo ng bakuna mula sa producers directly? Or kaya ba natin somehow na i-marshal yung ating resources para makapag-mass produce niyan? Kasi hindi natin maaabot yung tinatawag na herd immunity kung hindi naman karamihan ng mga Pilipino ay nabakunahan. So, dahil doon, up to now, wala pa tayong masyadong naririnig mula sa gobyerno pagdating sa mass production na ito, sa distribution, kung sino ang uunahin, sabi, yung mga militar daw, yung mga police, pero sana equitable din pagdating yan kasi hanggat hindi nababakunahan ang karamihan ng Pilipino ay hindi pa rin magiging safe buksan yung ating ekonomiya. So unfortunately, Albert, at the rate we're going, mukhang late 2021 or even early 2022 pa ito matatapos, I think.
All right. Thank you so much. Maraming salamat, JC, for that. Actually, parang I'm sure marami tayong mga kaibigan sa DOH, sa DILG, sa DSWD. If there's one thing I wanted to end this conversation on, there's been a lot of constructive comments, a lot of constructive suggestions from all of our three speakers. And I'm actually quite happy to say that we're ending this on a very parang collaborative note na yes, we see problems in the response. Yes, we feel that parang we could do more. But that feeling that we could do more is exactly our way of reaching out to all sectors, not just to the government, but to also our private sector friends na we're all in this together. Yeah, para talagang world peace. We're all in this together. And having said that, as your moderator, thank you so much kay Sir JC, Mr. JC Punong Bayan, our resident economist for tonight, Dr. RJ Nagit, our mental health advocate and activist and young frontliner, and Dr. Maria Naval Rivas, our other frontliner also, and pediatrician advocate of children. I'd like to pass back to Ms. Joy Alampay. because we'd like to thank Asia Society Philippines for organizing this very fruitful discussion. Joy, over back to you.
Thank you, everyone. It was great. It was great, Albert. I think we have a part 2 in the making, and there's so much topic to talk about. Diba, JC? And I think Dr. Naval would agree. We can focus on other conversations, on mental health, on what's happening to our children, what else is needed for our economy. So I want to thank all of you, and good evening, everyone.
Thank you so much. Magandang gabi po. Have a great dinner.
Thank you.
Bye.
Thank you.
Bye.
Thank you.